So I think that's a very petty sort of a debate to begin with.
Really?
Dental students are better than dental students are. That's like, however, interesting. That's like another thing I want to talk about.
What is up, you guys, and welcome back to another beautiful podcast over here today. Right now, what's the time right now? It's 12:35 a.m. We're shooting this episode. We have a very special guest over here.
3
We have a
p.m.
very
here.
special. Yeah, the two time zones. You know, we're killing it. We're providing you the best content ever in podcast history. And today we have a very, very special guest. He's a personality. We have Usama Azad over here. But before we dive into the podcast, we want you guys to like and subscribe this subscribe to our channel and our content. If you guys like this video, if you guys see my face, if you guys see Salman's face, just hit that like button, fucking obliterate it. I don't care, man. Just make that shit turn blue. And yeah, that would really mean a lot. We also need you guys to please subscribe. Khuda ke waste. We've made 24 episodes so far. We made 24 episodes, guys, in the past 2 months. Nobody's been as consistent as us. No fucking buddy. And please show us one more content creator who's as consistent as us, creating podcast episodes for you with new guests every other day. Is it like every day now? Like we have a new guest every single episode.
Every other day.
Yeah. We have
Every other day.
we have a new guest every single episode, man. So please subscribe. Khuda karo yaar. So yeah, Usama Azad, this guy. So who is this guy basically? So this guy is a dental student, but he has a lot of passions, a lot of different things that he has a lot of controversial opinions about, and this should get really fun. I am super excited about this podcast. So Usama, take it away. What's up, man? How are you doing? Let the world know who you are.
I am good. Sorry, I couldn't hear that.
What? What? Did
Hello?
you not hear anything?
No, I did hear you. That's not like I didn't hear you entirely. I just didn't hear the last part. You were saying something.
Yeah, I was like,
Oh, he said, "Let the world know who you
let the
are."
world know who you are, man.
I am just a normal, mediocre dental student, and I basically have a few things just to share regarding dentistry and how I see it. As a dental student, I would like to represent a small part of the community that belongs to dentistry as dental students, and let's talk more about it. Let's get started.
Before we go any further, as a dental student, you learn only about dentistry or also about like other types of medicine? Like, is it very focused on like dentistry, or like compared to like someone who's studying to be a doctor, how much overlap is there with the stuff you're learning?
You're talking about dentistry, right? As a dental student.
Right.
So basically, in the first year, we study the head and neck and the subjects that an MBBS student studies for 2 years. We study that in 1 year, but it's quite specific. It's quite inclined towards dentistry. For example, the anatomy of the head and neck, and we're then going to use that in our surgeries. And they're the same subjects for an MBBS students, but we study that in 1 year.
Yeah.
So that's how it is.
So it's quite compressed. So do you learn as much as a normal MBBS student, or do you just learn the specific parts that you need to know?
I think that that's quite an interesting question because there's a lot of debate over that particular question, and I think that it's not necessary to focus on what is better and what is not, and who studies more and who studies less. What's better is that what you're getting out of it and what you're entirely focusing on. So what's good about dentistry is that in the first initial years, we entirely focus on those particular subjects that are necessary for your head and neck entirely. For example, your oral surgeries, but we study that in 4th year. So basically we build up all those premature sort of जो आपकी understandings होती हैं in our anatomy, in our physiology. So I think that's a very petty sort of a debate to begin with.
Really?
Dental students are better than dental students are. That's like, however, interesting. That's like another thing I want to talk about. Is there's a lot of debate on social media and just in general just demoralizing dental students that they're not doctors or anything.
I've heard that before. I've heard that before. So chime in on that argument.
Here a question arises. Is a cardiologist is a gynecologist. No, it's not. You're specialized to do something. So that's I think that's very important for you to understand as being a medical student, that you are sorry. So it's important for you to understand that you're good at what you're doing, rather just debating on that you know more than someone else. So I think like that debate isn't valid at all. Like,
you don't think that debate is
baat
valid
karne
at
ki
all?
nahi hai.
Like, all right.
Totally,
all right.
So
absolutely.
instead of taking a side, you're saying you like anyone who takes a side is wrong. Like straight up, throw everyone out the window.
Throw everyone out the fucking window, bro.
Because why don't we do that's something that's not entirely relative to dentistry versus MBBS. I think that goes around in Pakistan regarding everything. हम अपने individual path पे focus नहीं करते. We're just comparing ourselves कि I'm better because I don't get because we don't get to see the other side.
Yeah.
So I personally feel like it's very necessary to just focus on what you have and what your specialty is, rather just debating over who's better. Like,
exactly.
No one really cares about it.
Exactly. I totally.
In the end of the day, you signed up. In the end of the day, you signed up for helping out people, for providing your services, and for a very noble cause. I personally feel like इस सारी debate में और इस सारी fight में वो एक noble factor और वो एक जो आपका divine purpose है to just something that made you start in the first place, that gets diminished.
I agree.
Yeah, that's fair.
So,
That is fair.
That's a strong point you make.
That is a strong point.
But putting aside the politics, I know being medical dental student is insanely hard. I know it's like terribly busy. You've said this like even leading up to the podcast that like it's a lot of work. So how's the pandemic affected that? Like I know most universities have gone online or shut down. How's it for you right now?
So as per a dental student, the pandemic is like quite affecting my individual learning, and I feel like I'm not the only one, because in dentistry, like from third year and fourth year onwards, you approach towards the clinical aspect. You're more practical and you're entirely experiencing everything. So I think the only thing that brought me down throughout this pandemic was missing the clinical side and like interacting with patients and just waking up every single day to learn, and just having this curiosity all the time to just study and being more curious. So like I think it's pretty much pointless to study surgery on Zoom. Like definitely you don't have a clinical exposure. So it's but it's better than doing nothing. And I feel like by now all medical students, I personally feel like as individually should realize that this pandemic isn't going to settle any soon, and there's it's their high time to just realize that they need to start adapting to it mentally and physically.
Yeah.
So there's no excuses. Like right now we're in a pandemic. You don't know when it's going to end. So just why not incorporate what you have, and just make the most out of it.
What I want to ask is that before we even got on this podcast, you were telling me on call that there are a bunch of myths and a lot of misinformation regarding COVID. So you have some you have some pretty credible information regarding COVID and how people can build a strong immune system regarding that and everything. How people can stay safe.
Yeah.
Dude, as of today, Pakistan, how many cases are there in Pakistan right now? You know the stats. Take it away, man. You know the stats.
तो basically पाकिस्तान के अंदर फिलहाल we've got a population of 212 million, and I think 80 मैंने अभी like I just want to quote the exact जो आपकी statistics हैं. 80,000 people are positive.
Oh wow.
And I think 3,000 plus are in Islamabad.
3K. We've got 3K. We've got
3K. 3K are in Islamabad today.
Speaking of
and there's
cases,
one more thing I want to share about.
I have a good friend of mine. She lives like a street away from me. Her dad tested positive for COVID. So literally, COVID is an I-8, boys. COVID is in Islamabad.
Dude, I heard they sealed G94, man.
Fuck, really?
Yeah.
They need to.
Like, that's where I get freaking hulluppery from, man.
I think it's a shame for us people that the government is still trying to just seal things. Why can't we just understand it as a social and एक existential responsibility to just sit home, because that's the only little thing that you can do.
That's fair.
Because there's nothing else. I did a few workshops with UHS, and I did a workshop recently with Harvard. Or the information I grasped regarding COVID is that there's no chance of getting a vaccine in the next, I think, 28 months.
Wow.
So
28 months.
And even
That's over 2 years.
Like, after inventing a vaccine, like, you have to go through human trials and animal trials, and you need to get a consent for that. So there's a lot of processes, and then you make a duplicate version of it, and then there's distribution. It's like a entire long process. So I think there's a lot of time for that, and you need to by now you need to just understand that you need to improvise and make the most out of what you have. And I feel like it's a privilege in Pakistan, living in Pakistan and surviving COVID, because you're not unemployed, you're not living under debt, you're not living, you don't have to worry about mortgage, like relative perspectives. And like, I think personally we have a lot of so many contacts, family hai, koi na koi kisi ka doctor hai jaane wala. So we have a lot of facilitation. I personally feel like, what do you have to say about this, Salman?
I think that's really fair. Like, for us, people like us, it's really easy to stay home, but I think we have a lot of day laborers, a lot of people who work.
Yeah.
They're earning, a couple hundred or however many rupees a day, and that's what they're living off of. They have no way to get access to food if they're not working.
Exactly.
So I think, that's the issue. Like, you can't ask them to just sit home, because they genuinely cannot sit at home.
Yeah. And Pakistan's a country, and Pakistan's a country that cannot provide you stimulus checks, because, dude, we are economically, we are fucked, yo. Dude, straight up, we can't just give handouts for a long time.
To do something like that.
Yeah.
How are things there, Salman? Like, how
in the
are
US,
your colleagues?
It's a lot better. It's not great, but I mean, most people are managing to get by just fine. I think they're paying everyone unemployment right now, so people are at least living life comfortably. I know some people in Canada, and over there, apparently, like, they've done a great job. The government's just taking care of you, like, no matter what.
Yeah.
So all you have to do is just, like, isolate yourself and just wait for this to blow over, and that's it. Like, you don't have to worry about money, about food, about healthcare. The government's just, like, on it.
Yeah.
So I mean, really, like, that's like the whole spectrum. Like Pakistan,
how long do you
US, think? Canada.
How long do you think this lockdown is going to last over here? How long do you think it's going to last?
The lockdown, honestly, it does. In Pakistan, it doesn't really, honestly, I think people shouldn't be focusing on how long is the lockdown going to last, because it's going to last for a very long while. And the government definitely, we as, considering our economical statuses and how the government is taking out statements day by day, I feel like they're definitely going to lift the lockdown up, because people need to work, and like, it's entirely changing the dynamics of the country and how finances are being run. But I feel like that's something that shouldn't be our entire focus. This pandemic has entirely changed the dynamics of how we saw life, and how everything it has affected every single person.
So what I want to know is that
I'm also on the process of,
when do you think unis are going to open? When do you think offices are going to open? When do you think restaurants are going to open back up? Because those are the things that I am personally interested in. Because I want to know, when the fuck can I go back to uni? When the fuck can I go back to vlogging? Because I can't vlog right now. So, like, do you have any stats regarding that, or any predictions from experts?
Yeah, I can only represent and talk about the information I have regarding my university. It was till, I think, 15th, coming 15th, and now they're just definitely going to take it off, because they're just taking off, they're just updating us every single month and every single week that it's going to open next week and stuff, just so that we don't feel shit about our fees and everything, private colleges. So, other than that, honestly, there's no point of it. I'm just worried about my personal clinical skills, because the only thing right now I can do, there's this thing called phantom hits, or stimulated patients hote hain, basically. So I could get one of those, but it's definitely not experiencing it over a new patient. Like, we used to do around 6-7 patients daily.
So you're talking about getting like a fucking dummy and practicing on that dummy, or like that little doll shit, and Just like, you know.
Absolutely, that's
Oh
all.
my,
That's
what?
the only thing I can do.
What? Oh my god. Oh my god.
Because we do practice it in our college on
Yeah.
phantom heads, और मतलब बाहर भी अगर आप कहीं भी workshop करते हो तो before your
Yeah.
patients, और बल्कि यहाँ तो खैर I think it's a privilege for Pakistani students, dental students or medical students that
Yeah.
you don't have like we are strictly taught about consent and all these things, but there's not as much legal action or versus the आपकी जो overall public requirements हैं healthcare की. It's so much and it's so saturated that we get ample amount of exposure and we get ample amount of patient practice.
Yeah.
So
यहाँ ये scene है, but
okay.
I don't know, man. I'm also kind of stressed out because not having clinical skills, I really don't know.
Don't worry.
I'm sure
What to do
over
about it.
time, you know, they'll find a way to make up for that.
Yeah.
But I think what I want to know is like, do you have any stories of like students who've messed up on patients, like real patients?
Yeah. Like something like
Does that happen?
Okay, I won't like name people, but
course not.
yes,
Of course.
I think that has a lot to do with the sort of peer pressure and the sort of pressure university gives you, because like the thing is that my college has like almost the highest quota in Islamabad, so like we've got around 170 extraction patients for like 2 years. That's a lot. So and if you don't like qualify and if you don't like fill up all your complete your quota, so you can't sit in the prof.
You can't sit in the exam.
So and versus in Kings, in like बाहर जो है वो ये सीन है कि you get to do around 5-6 patients, ठीक है, 5-6 extractions maximum.
What?
Because they focus on the quality of patient versus the quantity of patient. But here it's different. The dynamic is different. Yes, they are updating. PMDC is working over it. Universities are revising their curriculums and stuff.
Yeah.
But the thing is कि यहाँ जब आपके पास इतना प्रेशर होता है कि आपने 170 पेशेंट करने हैं और either you do this, so in the first 50 patients you have that empathy, and yes, I recall a lot of people who till the end follow all their protocols and all their procedures and like wait a second. So they're following up all of that, but like when you're near your end, sort of ending your quota, so that's where they mess up.
So what happens?
It's not their entire fault, but
what
happened? I'm curious. What the fuck happened, bro?
If you mess up, for example, like there's this thing called BDR. BDR is like broken root. If you like extracted tooth and you accidentally broke the root of it and it stays inside, so it's quite hard to just take it out because like it's not a whole tooth now. So basically what happens is that we have to do a surgery where we cut the bone, and it's a bit complicated procedure for a student. That's where we have our house job and house officers, and they just help us. That's something that's a huge advantage here in studying in Pakistan and being a dental student here in Pakistan, that you always have seniors and you always have people just to look after you, just to take care if you mess up. And it's just not like, in the end of the day, the patient is satisfied. I'm not talking about messing up and just like deteriorating a patient's experience. I'm talking about messing up at a student level, and then you do have things to just cover it up. You do have seniors to look up to you.
Yeah.
So that's about it.
So I think we are approaching time. What I want you to give, Usama, is that just final pieces of advice for people who are applying for dental college, or what they can expect coming into dentistry, the things that you did not know before you came into college and you learned all those things. That final piece of advice for anybody who's coming through. The final,
like I don't think I'm in a position like that, but by my experience, personal experience, and by the experience I've had looking up all my seniors and stuff, I could just say that focus on making your concepts and not look at the bigger picture, because medicine is a field that requires a lot of patience, and you need to understand that there's always going to be a person better than you. There's always going to be a surgeon better than you. Mm-hmm. So there's no comparison and there's no winning at it, because in the end of the day, a patient's life is in your hand. A patient's forever life trauma is in your hands, and you get to decide. You get to control that, and it's like a huge thing if you think about it. So having said that, you need to have that patience throughout the procedures and throughout the years that you're when you're approaching towards the clinical aspect of it. I personally feel like first year में हर बंदे को एक lab coat की और white coat का बड़ा एक shock होता है and everyone's like flexing के
I'm a dentist
do you need any advice? I'm a dentist bitch. So I think when you like grow over the years, you become more humble and you become less inclined to all that ego and all that stuff.
Oh, okay.
So that's about it. Just focus on having patience and learning. And there's only one winning at medicine. It's just a person who knows more than you.
Damn.
So knowledge is honestly power, and
that's
like if you want to be better at it, you just can learn more. That's about it.
That is amazing.
That's super
Take it away, Salman. Outro.
But also
outro.
Well, hey, before the outro, man, I have to ask this. Saad mentioned that you used to be inclined towards like arts and stuff. I know you've got a DSLR, a tripod, a gimbal. You've got more equipment than we have, man.
Yeah, man. What's up?
So what all have you been doing? Is it music?
I have not been doing anything. It's been a long while. It's not about having a creative block or something. It's a decision I took myself, and there's no. Firstly, I've made mistakes. I did went into that sort of a race, and I did disappoint a lot of people. By like those of you who are watching this video might understand by what I mean by that. But the thing is, in the end of the day, you need to realize that you're not in a race. You're not comparing. You don't have to compare yourself with anything. Social media does get you. It does get to your head, and you are unconsciously comparing yourself.
You are.
And I feel like it's very important for you to realize that why I stopped making music and why I stopped being inclined to that. Because I personally know, and I am friends with a lot of devoted, hardworking people who are devoted to the subject since day one, and they're taking out content. You know the name Sanya, all these people, Mani Bhai, so many people. They're completely devoted, and it's quite amazing, and it's so good to see someone living your sort of something that you got inspired by, and they're just flourishing in it, and you always hope the best for them. But my personal reason was the seriousness I had in front of me. Like, I have to study general surgery, man. I have to study all of these things. And then I was like, there's no rush into it. I'll get done with my degree. And then I'll focus on when my life gets settled down, when I'm pursuing, when I'm done with my BDS, I'm just gonna go for all these small things that I always wanted to do. My inclination towards art, music, filmmaking.
That's so nice.
Because right now, you need to stay updated. You need to stay. You need to learn new techniques. You need to just if you really want to do something, you just can't stop thinking about it day and night. And I used to be that person, but right now it's the same for my passion towards dentistry, and it's my passion towards medicine. I just can't stop thinking about it.
That is amazing.
So I think it's very important to focus on what you have on your hands, and not just rant about कि ओहो यार मेरे पास वो gimbal या tripod नहीं है, shit man, I can't make content. So I think that's also very relative to dentistry and starting like going abroad, like after medicine residencies and all these things. Like it's been a year or two I've been studying for one of my license exams, or I've been like meeting up all these people over the year who already are residents there working in the NHS. I have more friends there in Kings that I have here in my college that I'm not ashamed of. So they're always helpful, they're always encouraging, they have a very sort of a nourishing sort of a environment they give, and they're always ready for new ideas. So the thing I realized, in something that my dad also made me realize, by the way, he's a dentist as well, he's a prosthodontist.
Oh, nice.
So what I got to realize is that there's a lot of system blaming here in Pakistan कि यार पाकिस्तान का system नहीं ठीक, oh पाकिस्तान में research नहीं हो सकती, oh I have to go to Kings bro, I need that sort of nourishing environment to flourish. That's not quite true. You need to realize in life you need to make the most out of what you already have, And when you saturate yourself, then you can think about new ideas. No one's stopping you. But I think हमारी ना एक young generation में और ख़ास तौर पे social media के influence की वजह से we set a lot of unrealistic sort of goals, and that's where we fuck up. That's where we're just bullshitting to our own self. Either be medicine, either be anything. So I think we need to realize I think for me the more smarter person is who realizes where he's wrong, where he's messing up, and when he's lying to his own self.
That is all like insanely profound. Like, thank you so much for coming on, giving us this I didn't know this would be such a profound episode with such like deep talks about like the meanings behind why people study medicine.
Yeah, man.
That's insane. Thanks for bringing that viewpoint onto the show. It was really nice having you.
Thank you so much for having me, man.
Yeah. For all of you out there, please click the subscribe button, click the like button, and leave a comment. And on that note, we're out.
Peace, adios, goodbye.